Hi, my name is Caitlin Smith, and today I'm here to talk to you about the importance of communication in mental illnesses. We all may know someone or may be that someone that suffers with a mental illness and a struggle with the communication aspect that comes along with the disorder. When others try to communicate with people with mental illnesses, they often find it hard to understand what they go through on a daily basis. This lack of knowledge can interrupt simple communication and make it hard to communicate with someone. Without taking steps to correct these problems, these people may feel voiceless or unheard. It is our job to be mindful of how these people feel and to respond to their emotions effectively. Today in this speech, I will be discussing ways to adequately communicate with people with mental disorders through family, teachers, and healthcare workers. When communicating with a family member with mental illness, it is important to be patient and understanding. Ingrid Walton wrote an article in 2016 for the National Alliance on Mental Health that describes simple ways to communicate with your loved one. In this article, he discusses how you should use reflective listening, which will motivate your family member and show them that you care. He said you should reflect what they have told you and ask questions to better understand their emotions. By doing this, it'll promote them to want to communicate with you more in the future. Ingrid continues in the 2016 article by saying you should stay away from reactive listening, which will only provoke conflict rather than progress. He says instead you should try to see your family member's point of view and understand where their reaction is stemming from. Behavioral Health Evolution wrote an article on their site called Family Therapy Tips to Improve Communication in 2016 that helps cut down on rising stress in families and struggle with communicating. In this article, they say that you should use I statements rather than you. This will help better explain feelings and prevent misunderstandings by assuming each other's emotions rather than clearly stating them. Now that I have discussed how family members can communicate with their loved ones, I'll move on to my next category, which is how teachers should communicate with mentally ill students. As a teacher, you should remember not to make your students feel inadequate or pressured. In 2019, Vantage Point wrote an article on their site called How Teachers Help Students with Mental Health Disorders that explained how teachers can make mentally ill students more comfortable at school by involving them more. In this article, it said that teachers should create more flexible classrooms, which helps students to remind themselves that they don't have to be perfect. This will help students feel more relaxed and more likely to discuss problems they are having with the teacher. The Vantage 2019 article continues by saying there are different ways to respond to a student's mental illness. That teachers should teach problem-specific skills and help students set personal goals. This will help motivate them and show the teacher cares about their well-being and their academic success. Michelle McDonald wrote an article on the Irish Times in 2010 highlighting strategies to create a safe space for children and how to promote positive behavior. She suggests that schools should offer specific classes on mental illness to open discussions for problems students are having and show them that they are not alone. McDonald continues in the 2010 article by saying that schools should also offer counseling, which will promote positive communication, and it also offer students one-on-one talks instead of in groups. Now that I have explained how teachers can communicate with mentally ill students, I'll move on to my next topic, which is doctors communicating with their patients. As a doctor, it is important that you engage and establish trust with your patients. Lee published an article in the Student Doctor Network in 2016 that states that as a good doctor, you should treat your patient as an equal in the process of achieving good health. This article states that you should communicate person to person and not use terms that are over your patient's head. It says if they clearly understand the objectives of their treatment, they are more likely to participate. Lee continues in a 2016 article by saying that trust is crucial, and without trust, they are less likely to share their issues they are having. Also, creating a judge-free area is key to creating trust and will allow the patient to communicate openly and without embarrassment. In conclusion, when communicating with those diagnosed with a mental illness, it is important to respect their emotions and to find ways to motivate positive outcomes. I discussed how family members should listen to their loved ones and better understand what they are going through. As a teacher, you should make a student feel comfortable and offer aids in the classroom. In a healthcare field, it is important to involve the patient and promote trust and a positive outcome. While mental illnesses can sometimes be hard to understand, those who are affected deserve the extra attention it takes to provide better communication and to feel that they are not alone.